While vitamin B12 is often typecast as the anemia-preventing, nerve-protecting vitamin, a growing body of research reveals it may also quietly defend one of our most vital systems, the cardiovascular network. Most conversations about B12 and heart health stop at homocysteine, a sulfur-containing amino acid that rises when B12 is lacking and is well established as an independent risk factor for heart disease. But exciting new insights suggest B12's protective reach extends beyond just keeping homocysteine in check, offering a more direct, multifaceted shield against cardiovascular disease that deserves far greater attention. One of the most intriguing pathways involves endothelial function, the health of the thin layer of cells lining blood vessels, which regulates everything from blood flow and clotting to inflammation and vascular tone. Studies have found that low B12 levels impair endothelial nitric oxide production, reducing the vessel's ability to dilate appropriately in response to increased blood flow. This dysfunction is a key early step in atherosclerosis, as stiff or reactive arteries promote plaque buildup, increase blood pressure, and raise the risk of heart attacks and strokes. Moreover, elevated homocysteine, often caused by inadequate B12, can directly damage endothelial cells, increase oxidative stress, and promote a pro-inflammatory state within the arterial wall. But even beyond homocysteine reduction, B12 itself appears to have anti-inflammatory properties that may help stabilize existing plaques, reducing the chance they rupture and cause life-threatening clots. Emerging evidence also hints at a role for B12 in lipid metabolism. Some studies suggest that B12 deficiency may contribute to unfavorable lipid profiles, including higher LDL cholesterol and triglycerides, both of which accelerate atherosclerotic plaque formation. While the mechanisms aren't fully understood, it's thought that B12-dependent methylation pathways influence hepatic lipid synthesis and clearance, subtly shaping how fats circulate and deposit in blood vessels. What makes this cardiovascular connection especially mysterious is that B12's role is rarely considered in mainstream heart disease prevention. Current guidelines focus primarily on cholesterol, blood pressure, smoking, and lifestyle factors, overlooking the simple, correctable possibility of B12 insufficiency, particularly in older adults, people on vegetarian or vegan diets, or those with absorption issues from gastric surgery or chronic use of acid-suppressing medications. These groups are at elevated risk, not only of classic B12 deficiency symptoms, but also of insidious vascular damage that can progress silently for years. The hopeful aspect is that restoring B12 levels is straightforward and affordable. Supplementing B12, either orally or via injections when absorption is impaired, has been shown in some trials to improve flow-mediated dilation, a sensitive measure of endothelial health. Other studies indicate that aggressive homocysteine lowering with B12, folate, and B6 can modestly reduce stroke risk, though definitive cardiovascular outcomes data remain mixed and warrant further research. Ultimately, the overlooked role of B12 in cardiovascular protection reminds us that atherosclerosis is not just a disease of cholesterol but of the entire vascular environment, including the biochemical processes that support endothelial integrity and regulate inflammation. By appreciating and addressing this often ignored contributor, we can better fortify our arteries, reduce cardiovascular risk, and build a more comprehensive strategy for lifelong heart health, adding yet another vital reason to ensure this humble vitamin doesn't fall through the cracks.